evidence-based nutrition information focusing on addressing the root cause for imbalance. Food has the power to help you achieve lifelong optimal health without the side effects of prescription medication. Subscribe on Apple Podcasts, Spotify, or any other podcast platform. I am Stacy Seslowski, Functional Nutrition Registered Dietitian.
And I am Leah Grace Barrick, Functional Nutritionist.
Hi, everyone, and welcome to the Power of Food podcast. We have a very special, super interesting guest today talking all about speech and voice and the connection between that and nutrition, which is something super fascinated. Neither Stacy nor I really know anything about, so we're really excited for her to be here. And so Christine Sofiane Katzenmaier is a California state licensed speech language pathologist and CEO of Speech and Voice Works. Christine obtained a Master of Science degree in Communication Sciences and Disorders with distinction from California State University, Northridge, and holds a Certificate of Clinical Competency in Speech Language Pathology from the American Speech Language Hearing Association. Christine helps people who rely on their voice for their profession and struggle with speech problems, voice loss, hoarseness, vocal fatigue, and discomfort overcome their anxiety and frustration and feel confident about the way they sound so that they can shine in their roles as professionals. Unlike the conventional approach of using vocal rest, Christine helps her clients learn how to use their voice in a healthy and sustainable way so they can have the self-confidence they need to succeed, get the job done, and have the impact they dream of. With her background as an opera singer, performance artist, and vocal coach, Christine brings extensive knowledge to the voice community and beyond. With a vast understanding of what it takes to be a vocal athlete and how to achieve a healthy and sustainable voice, Christine can help you shine in your public profession. Christine is a member of the Southern California Voice Foundation. Her work has been featured in peer-reviewed scientific journals, Voyagella, and podcasts like Positive Talk with the former mayor of Manhattan Beach. She also provides in-person presentations at venues including White Memorial Hospital in California. Welcome to the Power of Food podcast, Christine.
Thank you so much for having me. I'm so excited to be here.
Amazing. Well, like I said, we are so excited to learn everything you have to share from us. So we're going to just dive right in because we've got some juicy things to cover. And I'd love to hear, just starting off, what are some of those voice problems that are common in the clients that you see in your practice?
So there's a whole gamut of voice qualities and changes of the voice. For example, hoarseness. So I can sound really hoarse and raspy right now. That's a typical quality. I want to say that happens a lot, the hoarseness. Another one that can happen is more breathy. So right now you can hear me, but now I sound a little softer. I have more like a Marilyn Monroe voice. And that's because there's a lot of air that's passing my throat right now. Now, with hoarseness, for example, if I sound more hoarse like this, that could be due to if there's reflux. It could be related, if there's a vocal fold pathology, it could be related to voice strain. Another quality that I would find, and this I actually hear a lot, is Galaga Fry. So right now I'm talking, but I'm sounding a little different. And that's because right now my voice is placed differently. It sits more in the throat. And often you hear it at the end of the sentence. So now my voice is dropping down. That's a typical presentation of Galaga Fry. Another one could be hypernasality. So now I sound more nasal. I sound more like Mickey Mouse. But again, it has to do with the placement of the voice. Now more is going through the noise, through the nose, but you can hear how it affects the resonance and the quality of the voice. So another demonstration would be a monotone voice. Somebody that it sounds more robotic, it's more straight tone. So I'm talking right now, I'm explaining what I'm doing, but it might be harder to listen to. The reason why, because there's not much inflection in my voice, but I keep a steady tone with it. That is considered a monotone voice, and what it does, it's lacking inflection. And that is one that's hard for the listener to stay with because it's the inflection that makes a voice sound interesting. Another one that I find would be soft-spoken. Okay, so now you can still hear me, but you might have to listen really closely to hear me. And that's maybe because I'm shy. It could also be that I don't have the ability to talk louder. So a voice quality, there's difference in voice quality, but also volume and pitch that are all considered within the voice perspective, and that can affect how people are perceiving you. Yeah.
Thank you for that description and for the examples. And I know that we've heard, all those examples that you gave, and it really does change as a listener. It changes my experience and sort of the feeling that I get about the conversation and about the person that I'm talking with just by those changes in the voices. So thank you for bringing awareness to this. And I can't wait to learn. I feel like I could use some private sessions with you to help improve the way that my voice sounds. But how do you find the connection between nutrition and these different voices that you described?
That is an excellent question, and I'm so happy to be here today and share this with you guys, because I want to talk about how the nutrition and voice relates and how they are connected, because it's an important element that is often overlooked when it comes to voice care. In terms of food, we've been told you are what you eat. We're healthier, perform better, and feel better if we eat well. The same principles are true for the health and functioning of our voice. Similar to maximizing the potential of our body to function, there are foods and beverages that can either help or hurt your voice, and therefore the quality of your speaking and even your singing voice. Now, let me explain a little first how the voice actually works to help better understand then how the connection to food ties in with that. The source of the voice starts in the throat, in the larynx. Inside the larynx are two bands of tissue called the vocal folds. As we breathe and air passes through the larynx, the vocal folds start to vibrate and sound production occurs. Now, for normal speech, your vocal cords need to touch together smoothly inside your larynx. Anything that interferes with the vocal cord movement or contact can cause the voice to have a problem or have a voice disorder. Now, I often hear, I've always had a raspy voice, or my voice has always been gravelly. Well, that might be so, but a raspy voice is not typical. According to American Speech Language Hearing Association, a voice disorder is considered when a voice quality, pitch, and loudness differ just from what I demonstrated earlier, or if they're inappropriate for an individual's age and gender. Now, even more importantly, I find this very interesting that I put this in the definition. A voice disorder is present when an individual expresses concern about having an abnormal voice that does not meet daily needs, even if others do not perceive it as different or deviant. Now, statistics show that an estimated 18 million adults in the US report a voice problem. That means voice problems affect 1 in 13 adults annually. And I'm bringing this up because this number is significant. And I want to let our listeners know that when you struggle with your voice, you might feel overwhelmed, anxious, frustrated, and have low confidence. You might tell yourself, my voice is just something I'm going to have to live with. You also might feel alone in this. Well, let me tell you some exciting news here. You're not alone in this. And if you have a voice problem, it can be fixed fairly quickly in most cases. So let me trace back now to how your voice connects to nutrition. Have you ever experienced that annoying feeling of something sticking in the back of your throat when you need to talk or sing? This is often referred to as mucus or phlegm or postnasal drip, or having a frog sitting in your throat. And it's both annoying and it can interfere with your speaking. It can cause unwanted tickles, and it can make you cause and it can have your need to clear your throat. Now, these symptoms can be related to reflux and can negatively impact your voice. So this is where nutrition comes in. What foods, trigger reflux?
Amazing. Well, thank you for talking about, where our voice actually comes from. That's really interesting because it's something that most of us take for granted and don't really realize. So thank you for that. And that is crazy that 1 in 13 people, I had absolutely no idea how common that was. And it's really interesting that, like you said, with the description, that it's like only if someone feels like they have a problem. So even if other people don't recognize it, it's very much a personal thing. So that's super interesting as well.
It is, and often, and these are only the recorded cases. And out
Yeah.
of those cases, only 10% seek help. And so to me, that's also a sign people, there's still an understanding that, oh, I just going to have to live with how my voice is. And that is not true. A voice problem can be fixed, remediated fairly quickly.
Amazing.
But it's just this lingering feeling you can have with it. Oh, my voice is just how it is, but I don't know how to go about it. Well, there's easy ways to go about it.
Totally. Yeah. I had no idea that you could change it and it wouldn't take years and years. Like you said, it would be pretty quick. So that's amazing. So you mentioned reflux. I would love to hear which foods you find cause reflux and which foods you might want to consider if that were a problem for people.
Sure. Foods that may cause reflux or heartburn are spicy foods, fried food, fast food, pizza, potato chips, and other processed snacks, cheese. Now, foods commonly known to be heartburn triggers, they cause the esophageal sphincter to relax and delay the digestive process, letting food sit in the stomach longer. Other foods that can cause the same problem include tomatoes, tomato-based sauces, citrus fruits, chocolate, peppermint, carbonated beverages, as well as caffeinated drinks and juices. Now, that doesn't mean you can't have any of those, because a lot of those actually sound really good. But with anything, moderation is key. And since many people may not be able to or want to completely eliminate these foods, just try to avoid eating late in the evening, closer to bedtime, so food is not sitting in your stomach and coming up in your esophagus when you lay down at night. And it's also a good idea to eat small, frequent meals instead of bigger, heavier meals. Now, healthy foods you can eat instead are low acidic foods and foods that are high in fiber. Whole grains, root vegetables, sweet potatoes, carrots, beets, or then green vegetables, asparagus, broccoli, and green beans. And because acidic foods such as tomatoes or the spicy foods and some fruits and juices, they can cause reflux to worsen. And reflux has been found in some cases to adversely affect the voice by causing swelling and irritation of the vocal folds. Now, in terms of dairy, because that's always a hot topic, what about cheese? What about yogurt? But what I like my glass of milk and cookies. So there is actually no statistically significant overall association that can be detected between a dairy product intake and symptoms of mucus. Because the problem with the dairy or any of these foods, they tend to increase the mucus, and that tends to increase the throat clearing, which leads to the swelling of the vocal folds. So really with dairy, there's no evidence that it can cause mucus, but I want to say, just based on my clinical experience, it's really case to case. It varies from person to person. Some people, they might eat some cheese and have yogurt with it, and they're totally fine afterwards. Some people, they just look at a glass of milk and they need to clear their throat. So that I would say just depends person to person. Yeah. And also getting acid reflux case every once in a while is, absolutely fine. But some people suffer from burning discomfort in the throat or in the esophagus, bloating and belching almost every time they eat. And about 20% of the population has GERD. So diet plays a major role in controlling acid reflux symptoms, and with that, helping the voice at the same time.
You're definitely talking our language when you get to sort of the root cause for this type of imbalance, and then using whole food recommendations. And another piece that I love about this is that, like, I always tell people that your body shows you the signs and symptoms when something is wrong. So paying attention to this type of sign or symptom is just another way that we could really listen to our body and then do something to promote better health that will probably prevent something else from happening later on in life. So
Absolutely.
I love taking these little signs from the body that seem like not that big a deal, at first, where people will just kind of ignore it and say it's normal, it's fine, and I'll live with it. But then if you really pay attention and change what needs to be changed, you definitely will promote better health, in the long run.
Absolutely.
Yeah.
Just as an example, with as reflux affects the vocal folds, it tends tend to want to clear your throat. Well, there's actually a sensory neurofeedback. So the more you clear your throat, the more you want to clear your throat, even though there's nothing there. So that's something, if you want to start reducing that, that helps your overall vocal health as well.
Yeah.
Yeah.
I wonder if you ever also give recommendations on sort of triggering the vagus nerve and like that and digest process that our body uses to really promote the motility of food in the downward direction. That is something that I use as a tool. I think that nowadays, when we're living in this like state of fight or flight all the time, that when we eat and we're in that state, then food does not get triggered to move downward. It sort of just stays in one place. And that's when we get heartburn and bloating and things like that. So that's another sort of way to kind of inhibit that type of gastric reflux.
Absolutely. And one element that I incorporate in my practice is the myofunctional aspect, and that has to relate it with a tongue thrust, tongue placement. So I work more on the oral phase, on how food is being processed. It has to do how long are you chewing, what types of foods are you eating. But I look at it from a muscular perspective, because the oral muscles, we want to have those strengthened. And then in terms of the throat and neck tension, some people that have trouble with their voice, they tend to also have increased muscular tension in their head and neck area, in their jaw, and that has just related to how they're chewing and then what types of food that they're eating. So yes, I talk with them in terms of taking smaller bites, longer chews, and then staying hydrated at the same time, so that when they're swallowing, the food is chewed well, and they're also not swallowing air with it, which can also be a trigger for indigestion.
Love that. Are you also making recommendations on the voice itself, like what you can do to sort of like improve the sound of your voice?
Absolutely, absolutely. In terms of voice care, what you can do for one is help identify what is going on. So you can start, if you're starting out first, keep a daily log on how to observe when symptoms flare up. When your voice, let's say, is your voice worse in the morning? Is it, better in the morning? Is it worse in the afternoon or evening? And then another thing is, and then keep a log, so there is more of a, you can follow if there's a progress or if it's inconsistent. And also, the other thing is rest your voice when you can. So for example, if you had a long day where you use your voice a lot, and then you're at home talking to your family or your friends, instead of getting on the phone with them, maybe just send them a text or an email instead. So you're actually resting your voice. So you're reducing the vocal load. Yeah. And the other thing, very important, stay hydrated. Stay hydrated. You got to stay hydrated. I mentioned this earlier, overall for your body, but also for your voice. It's the surface membrane of the vocal folds that need to stay hydrated to keep that vibratory cycle going. And with that, even if the voice is being used all day long, just keeping that hydration going really helps the voice. And then the other thing is avoid trigger foods. If you know you're going to start clearing your throat a lot, you start feeling really gunky or phlegmy in your throat, try to avoid those. And then if symptoms do persist, consult with a voice specialist, otolaryngologist, nutritionist, or ENT if the symptoms persist.
Yeah, that makes a lot of sense about the hydration, which is another thing I wouldn't have even really thought about with the voice. But do you find people who are doing a lot of talking, like presentations, who are like thirsty, like they find their mouth gets really dried out when they're talking a lot? Is that a common thing that you see? I know I've heard that from people who like talk a lot, do a lot of presentations. I don't know if that's something you work on or if that's like totally something different.
Yes, so I do work with my clients on that because it's a very common occurrence. Also, when you have a performance, nerves kick in, and that in itself increases the nervous system, and with that can cause dry mouth. So even when you do a presentation, have some water with you to stay hydrated. Yeah, have a sip of water here and there. And for example, I work with cantors, and for them, it's really hard on high holy days when they have to sing, for 3 hours straight without taking any water in. Now, there's cases like that, you have to work around it. But if you're doing again, if you're doing a presentation, there's also breathing exercises you can do beforehand just to calm the nerves. So the dryness is more related to the nerves kicking in as you're giving your talk.
Okay, yeah, that makes a lot of sense.
And then again, the next thing leads into where is your voice as you're speaking? Is it low in the throat? You're going to work harder, and the longer you're going to talk, the harder you're going to work. Okay, and now I don't know how much longer I can talk because now I really have to push it, but my voice, I can really feel it. But yes, I think I'm going to make it through. So that's another factor on how are you using your voice as you're giving that presentation.
Totally. Yeah. And I wasn't sure, does it have anything to do with breathing through your nose versus your mouth too? Like I'd imagine if you're just doing mouth breathing, it would happen a lot faster, or you would get more dry versus nose, or
Generally, you always want to breathe through your nose,
Okay.
ideally. Yeah. Now, if you have allergies, if you're congested, you're not going to be able to breathe through your nose. But just do it yourself. Let your mouth open right now and take a breath in. What do you notice? Can you feel the air in the mouth? What are you observing?
definitely dries it out.
Okay,
I
now,
find that.
Good. Right. So now go ahead and rest your tongue up on the palate away from the teeth. And then just take a quiet breath in through the nose. See that the lips are sealed. And see if you can breathe through the nose and just do around like that. Now, which one feels more relaxed?
Nose, definitely.
Definitely.
Yes. Yeah. So sometimes just by habits, people breathe through their mouth. Now that could be because in the past they used to be congested a lot, and then the body just gets used to breathing through the mouth versus the nose. But this is something that's really important. Nasal breathing is really important.
Yeah, that's something that I personally have definitely been working on.
Mhm.
Because when I was younger, I definitely had a lot of mucus, like I had tubes in my ears. And so I think like that foundation did not set me up super well. So
Right.
even like sleeping at night, I use like the mouth tape sometimes just to facilitate
Excellent.
that nose
Yep.
breathing.
Mhm.
Because it is so much better for so many things and facilitating like parasympathetic nervous system versus breathing through your mouth, which like sets off the stress response. So it's all very,
Right.
very interesting.
Yes, and there is a bunch of research out there that supports nasal breathing, that it actually calms the body as well. It increases focus. It also has a dilating effect. So it might be counterintuitive wanting to breathe through the nose when you're congested, but the more you start doing it, the more it's actually opening up the nasal passages and calming the body at the same time.
Yeah.
So addressing the nervous system and how the body responds to stress is really important in voice care. And being able to have control over, because it really comes from, if you have control over your voice, you're going to feel a lot calmer versus I have no idea what my voice is going to do when I open my mouth and how long it's going to last. And that's where the stressor comes in. Yeah.
Yeah, I'd imagine there's a lot of anxiety with that, especially when it is often paired with like giving a presentation or something where there's already a lot of stress there.
There is that. And people that use their voice just, at work all day long and potentially are not able to do their work anymore. And they absolutely rely on it.
Yeah.
So again, they use it not knowing quite how to optimize it.
Totally. Yeah. So you mentioned voice rest earlier. Is that something you usually recommend to help resolve the problem? Is that like something that's a last resort? Can you talk a bit about that?
Sure. Voice rest, yes, it is helpful. However, I'm going to throw the however in there because it tends to be a typical Band-Aid solution. Now, if your voice feels tired, you give your voice a rest, the vocal folds can rest and start to rehabilitate slightly. Yeah, if your body feels tired, you lay down, take a quick nap, you feel a little better afterwards. Yeah. However, it does not address the root cause of the problem. So if your voice gets tired at the end of the day and you're like, yeah, I'm just going to rest my voice, that is fine. That will soothe your vocal folds. However, the next day you start running into the same problem again. And that is because the root problem is not addressed. Yeah. And voice problems occur due to underlying issues of either poor vocal habits, poor vocal hygiene, or overuse. And if those concerns are not addressed, just resting your voice will not do the trick. It's definitely beneficial, but it's not going to solve the problem. Yeah.
I guess, for people who just know that, like, I mean, myself, I literally know I'm going to be talking all day, every day. Like, are there things that I can do, kind of in advance, or even things like besides, like, I know drinking water is a great one, but like, even like healing, I know some people will like have sucking candies and which I'm assuming is not that great, considering they're all like sugar. But like, are there any soothing sort of remedies maybe that can reduce some inflammation in the vocal, folds that you were describing?
Soothing remedies, in terms of lozenges, I do recommend them. However, none that contain menthol in it because it's dehydrating. It opens up the nasal passages, which is great. Any mints or, they open up the nasal passages, but actually they have a high dehydrating component for the vocal folds. So I usually recommend like slippery elm is a really nice one. And elderberry without the zinc in it, because those are soothing and they keep the voice, they keep the vocal tract moist. And again, you want to have that humid environment. A great way if you want to warm up your voice, do some vocal exercises in the shower, because you're in a humid environment, and that's a great way to just get the voice started. Yeah.
I love those recommendations because, it's so interesting. I always like put these like connections when I have some new guests on like this that bring in some just totally different ideas, but it just always reminds me about how everything is so connected,
It's so connected. Yes.
Like we use those same herbs like you were describing, like slippery elm or aloe for inflammation in the gut. But, like it's all connected, the nose and the esophagus and then the gut and the vocal, they're all connected. So like, it's like, it's always like the pieces of the puzzle is just like fall into place when you start really thinking about how these things are working together.
It really does. It really does. Yes.
How long do you usually tell people that it takes for voices to improve over time?
So again, it all depends on the presenting problem, but I want to say usually about 3 months. So I have a 3 months voice program, IUBM, where my clients see significant voice change happen within the first session, and they move on from the first week onto the next. We start with identifying the problem and raising awareness. So just like we talked about earlier, does your voice get better in the afternoon? Is it better in the morning? Just having awareness, what's going on with that, so you can start tracking things, and then starting identifying the problem. And then we work on eliminating the trigger points and also the poor habits. Throat clearing, for example, or if vocal hygiene is really poor, if there's, no hydration, that needs to be implemented. And then from there, we go into building a solid foundation. That's where the technique of the voice comes in. And from building, we go into maintaining a healthy and sustainable voice, implementing it. And that usually happens within 3 months, where you are able to maintain a nice and healthy voice. Some people go on to stay longer. For some, it's a little less, but I want to say average about 3 months.
Amazing. I love
and if it's something more severe, 3 to 6, but like I said, that's about the range. So as far as I'm concerned, it's really a very short time span, considering how you can make a life-changing effect going forward. Yeah.
Totally. Yeah. And especially, I love that, you go again to the trigger, to the root cause, because if you don't address that,
Really important.
similar to everything in health, like it's just going to come back. So it sounds like a much more sustainable way to address these things that will definitely pay off. And like you said, it's a short amount of time for something that's really going to serve you for the rest of your life. So That's awesome. That also, typically it takes around 3 months, like you said, which isn't that long, maybe 6 months, even still not really that long. So amazing. Yeah. So what are 3 things that our listeners can do right now to start building a healthy, sustainable, and confident voice?
Number 1, stay hydrated. I know I keep going back to the cookie jar, but it's really, really important. Stay hydrated. And you might ask, well, how much should I drink? So the rule of thumb is there's 2 things you can go by. Either drink until your pee is clear. If you take vitamins, that might not work. So I caution you on that. Another way to gauge it is take half your body weight in fluid ounces in terms of hydration. Number 2, rest your voice. Avoid unnecessary talking. If your voice feels tired, if your voice feels fine, by all means, go for it. But if you feel like, you know what, like halfway through the day, and I just want to talk to my friend now, or just do a lot of talking that could be done otherwise, try to reduce your vocal load. And then number 3, avoid shouting or screaming. Now you might think, what do you mean? So now we can go out again. We can socialize. We can go to noisy restaurants. We can go to the ball game. We can go to concerts. There is a lot of screaming, shouting, excitement that actually can be very harmful for the voice. So if you go out and you find your voice sounding a little more hoarse when you come home, that's related to when you're shouting, you're basically slamming the vocal cords together really hard. And that can again cause stiffening and swelling of the cords, which in turn can lead to a hoarse or raspy voice. So
thank you for those amazing suggestions. I actually realized, even just as a nutritionist myself, I'm going to start to use that when I see my patients as a sign of things. And I might even start, just bringing their awareness, making them aware of, oh, I noticed that you have a little clearing of the throat or like sound like that. And just kind of making them aware of that this is something to also be paying attention to.
Absolutely. And that's where I think of you guys, because, when I see a client who has, there's a lot of postnasal drip, and then just allergies, throat clearing, like nutritionists can help you with that, a functional nutritionist that, because again, you got to look at the whole picture, and that's how you get the results.
Yeah, exactly. Well, thank you so much for being here, Christine. Are there any sort of last, bits of advice you want to give before we tell everyone how to find you?
Yeah, so if you want to learn more about how to build a healthy, sustainable, and confident voice, I'm offering a free 15-minute discovery call. Let's determine what root cause issues are keeping you stuck, are holding you back professionally, and are causing you to feel insecure about your voice and in your daily life. So let's help you shine again. And you can reach me at my website, www.speechandvoiceworks.com.
That was awesome. Thank you so much for being here. I really think that
so much for having me.
Yeah, our listeners are definitely going to find that information really valuable. And just to remind everybody, my name is Stacy Cisłowski, and my company is called Heal From Food. And you can email me at stacy@healfromfood.com, or my website is healfromfood.com. And then here is...
And I'm Leah. You can find me at gracefunctionalnutrition.com and shoot me an email at leah@gracefunctionalnutrition, or find me on Instagram at gracefunctionalnutrition. Thank you so much again, Christine. It was such a pleasure
having you.
Thank
you so much for having me. It was great being here.
Bye, everyone.
Bye.